زملائنا الاعزاء اطباء الاسنان وطلبه طب الاسنان، نرحب بكم بهذا اليوم في برنامج ضمن البرنامج العلمي لمحاضرات منصه التعليم الالكتروني المستمر لنقابه اطباء الاسنان في العراق. نستضيف في هذا اليوم الدكتور اوفو اونروبي من جامعه ميشيغان كليه طب الاسنان في الولايات المتحده، ومحاضره بعنوان Don't Treat a Stranger. دكتور اوفو حاصل على شهاده البكالوريوس في طب جراحه الفم والاسنان، وحصل على شهاده الماجستير في الصحه العامه، وحصل على شهاده دكتور اوف دنتال ميديسن، وهو حاليا يدرس برنامج الاختصاص في مجال البروستودونتكس في جامعه ميشيغان كليه طب الاسنان. وكذلك سيتم التنويه خلال هذه المحاضره على مجموعه من برامج التعليم المستمر التي تنظمها جامعه ميشيغان كليه طب الاسنان، وان شاء الله ستكون مفيده للزملاء العراقيين. Dear dentists and dental students around the world, you are all welcome today in the program of Iraqi Dental Association Continuing Education Online. Today we are hosting Dr. Uvoh Onoriobe from University of Michigan College of Dentistry. Dr. Uvoh today will be speaking about prosthodontics in a webinar entitled Do Not Treat as a Stranger. He will also be speaking about continuing education online program that he runs called Dental Webinar Series, which will be a great opportunity for all dentists and dental students to be joined in. Now I will leave the mic for Dr. Uvoh, and I would like to thank him in advance for his time and effort with us today. The mic is yours, Doctor. Thank you.
All right. Well, nice to meet everyone. It's 12:18 on the east coast of the United States. It's good to be with you. I know it's past 7 your time, and looking forward to sharing just a little bit of information with you today. I'm going to share my screen, and we are going to get started. How is everyone doing? I want to just say hello. If you're in the chat section, you can just say hello. I just want to see a thumbs up that you guys are good. And all right.
اوكي. بس شباب الدكتور اذا يسالكم عن اوضاعكم هيك شيء تقدرون تكتبون بالشات، يعني بالتواصل ويا الدكتور باللغه الانجليزيه طبعا. I just wanted the note that you said, Doctor.
Okay, so today I'm going to speak on do not treat a stranger. Do not treat a stranger, because I mean everybody comes into your clinic, and of course you've met the patient before. If that is your first time of meeting the patient, so you're actually meeting a stranger. And there are certain things you must do. I think it's a good advice from an old dentist. He said you need to get to know your patient first. Most of us, okay, yeah, somebody comes in with a problem, and the tendency is for you to go straight ahead and start treating without taking some information. Just getting to know the patient, getting to know, have some information about your patient. But that is what we're going to talk about today. But I'm going to talk about a little bit about myself. I'm originally from Nigeria. Nigeria is on the west coast of Africa. We do have on the northern part of Nigeria, the Republic of Niger. We have on the east side, Cameroon. On the west side, we have Republic of Benin. And if you go further, Ghana. And Nigerians are happy people. Almost every weekend you have, there's something called Owambe. Owambe means there's always a party, there's always a celebration. Nigerians are very happy people, and it's a good thing to remember about that. Also, Nigeria is known for our soccer. I don't know if you guys have experienced Nigerians playing soccer in the different leagues around the world. There must be a Nigerian somewhere. We do celebrate soccer as a nation, our national team. Hopefully we can make some mark one of these days. But we do have, it's a place of art. A lot of bronze casting. On the left-hand side here, you see these are very famous artwork that were stolen by the British back in the day. And we're still trying to get some of them back home. These guys are really good, especially from the Edo part of Nigeria. Nigeria is a place of, awesome. I don't know how many of you have listened to any music from Nigeria. Nigerians like, there's a lot of music on here. We have Fela Anikulapo Kuti. Fela is a very, very powerful musician. is late now. When he sings, the government listen. And it's a lot of fashion going on. I'm sure you guys know about the Big Brother Nigeria. This is their host, Ebuka, very fashionable guy, and most people look up to. Nigeria is a place of large religious gatherings. One of the largest gatherings of religious gatherings in the world is in Nigeria. A lot of people meet, and that means a lot to us. It's also a place of fierce-looking policemen. So you got to be careful when you're in Nigeria, because the police sometimes the police is supposed to be your friend, but that is what it is. I had my dental education initially in Nigeria, so I schooled in University of Benin, Nigeria. I was recently back there to do implant. Hopefully, I'm hoping that we can, for those who are taking the course we're doing online, we can do a surgical training just on a cast, fabrication of a surgical guide. So I did go back recently. I did go do a Master's of Public Health at University of North Carolina in Chapel Hill, and also I was in University of Chicago to do my DMD training, and it's as though I've been going to school forever. I'm currently running up a residency in prosthodontics at the University of Michigan. Other than that, I do take dental care to different parts of the world. Hopefully, I'm going to come to the Middle East one of these days. I'm hoping to visit Jordan, and if there's an opening in Syria and Iraq very soon, hopefully we can make a difference. So we do have an organization called Healing Hands Health Society. You can be a part of it. You can take a look at what we do. We provide free, clean water for different communities. Just, our world needs a lot of help. And as a dentist, somehow we have something to offer. And also we do have, as a part of giving out, giving back, we do have a webinar series that we started over a year ago. We do have over 100 lectures that we make available for free to anyone who wants to learn something about dental implant training therapy. If you were interested, I'm sure if you go on Facebook, there's a group called Dental Webinar Series. I'm sure a lot of people who attend lectures are currently on here, but we do have coming up with the next one coming up is we do have no sound. Did somebody say no sound?
Yes, I'm working on that. I just will put a notice.
Okay, should I stop?
Okay. Yes, sir. Just a few seconds.
If you can hear me, let me know, and I will continue.
Not everyone was not able to hear you, just a few people, and I told them the notes, what they should do.
Okay, no problem. All right, so I said we're going to have our next separate presentation on endodontics. It's more of, it's more of diagnosis and treatment planning in endodontics, and we have a professor who's coming on. I'm sure we want to mute some mics. I can get a lot of feedback.
Sorry, doctor, I could not hear you.
I said I can hear some feedback behind. I don't know if you can mute some.
You like to hear from people here?
I said I can get some feedback. I'm hearing some noise in the background.
Oh, okay. Now it will.
All right. Okay, so like I said, we're going to have, am I treating the right tooth? A diagnosis and treatment planning endodontics by Dr. Pierre. Dr. Pierre, an amazing, very smart guy who trained in France and currently here as an assistant professor at the Colorado University School of Dental Medicine. If you register, we are able to take 1,000 people on that call. So if you want to, and it's a free lecture, obviously endo is something you always appreciate. We're going to move on to what we need to do today. So there's a quote here by a dentist from way back. He says to us, never, never, never treat a stranger. That a dentist must have a thorough medical history. You must have a thorough medical history of your patient. And that information is of inestimable value. That your medical history, don't assume somebody comes in, oh, pain, you need to ask all the questions, take your time, even if it's an emergency. The things that you can find out amazing. The man says, Dr. Tassitano says to us, do not undertake a dental treatment until you have found out exactly what the patient's medical history is. So that is critical. Sometimes we even stop treatment by asking the patient to go and get medical consultation. If you are not sure, it's better to ask the physician. So I'll give you an example. So I had a patient, and I read from the medical history that he had a reaction to general anesthesia many years back. So I just assumed that he was going to be okay. He did tell me he had problems with general anesthesia. I'm going to stop here and just ask, has anyone gotten into any situation where you were treating a patient and you were surprised? You were only aware of something after you have started treating the patient. Is there someone here? You can put it in the chat, and maybe Doc will help me if anybody responds. If you have a patient, if you had any patient you were treating and you were surprised, you were surprised at something the patient came with after you started treating the patient. Is anybody here? You had an encounter. You only knew the patient was taking
yes, Dr. Afra is saying no, not yet, and I'm just waiting answers. By the way, Dr. Hassan Ahmed says yes, he did. He faced something like this.
Okay, Dr. Ahmed, what did you face? What did you see? What did you notice as a surprise?
دكتور حسن شنو فاجأك باللي صار؟ By the way, Doctor, when Dr. Hassan answers, I will tell you a situation that I faced personally. It was in the universities. Yes, in the university clinic, there's a patient need extraction. I think it was for lower fourth, the first premolar, and I take the medical history and everything like this. But the patient was in a low educational level, so he was not able to give me the full details. As soon as I started, my senior noticed that this patient has what you can call it strange skin color. We discovered that this patient had an artificial heart valve, and so extraction, as my senior told me, extraction was never able to happen before giving him an antibiotic. So wow. It was a very yes. By the way, I was a few seconds from doing the procedure when my senior told me this point. Yeah, so I still remember this situation. It was 2 years ago, I think.
Okay. Yeah, so Dr. Hassan said that the patient had chemotherapy not too long ago, so that in terms of white blood cell, white blood count and all that stuff. Is the person okay to have extraction? Their physicians say they are fine, stuff like that. So I had a patient whom I saw. I had treated the patient, so I saw in his medical history, he said about 20 years ago that he did have a reaction to general anesthesia. So it didn't occur to me to find out from his physician whether he was okay. So I gave him anesthesia. His blood pressure was fine. I only took the blood pressure, and it was okay. It was about 117 over 68 or something like that. But the patient told me that he couldn't remember anything I did. He had some transient amnesia. that he could not remember. He didn't remember how he got home. The patient did not remember how he got home. He drove 2 hours home, and he couldn't remember. He lost memory of everything that we did. That was really, really surprising. I mean, since then, I've had to listen to Dr. Tassitano and find out and read through the medical history. You think it's a small thing. Sometimes you have folks with HIV, you have folks with liver problems, and they wrote it there. There you have folks with psychiatric problems. You have folks who are, especially people who are taking, they have seizures. You're suffering from seizures, and they didn't, you didn't notice it, or they didn't tell you, and you're trying to give epinephrine, you know, and you know, many things. You can trigger the stress. The stress of that treatment can trigger so many problems. But anyway, so at least if you don't remember anything, I want you to remember this slide, that you shouldn't ever, even if you are rushing, even if you are, oh, quickly, please, doctor, I am dying. Oh, no. You know, they can wait a little bit more, you know, if you are for you to get, so sometimes get medical consultation before you go ahead. So this is a patient that showed up. He showed up like this. So what would you like to, this is like a stranger to you. You know, I want you guys to tell me, we're going to continue, but I want you to tell me, what would you like to know? So this guy comes into your clinic, and he says, I want a good smile. I want a good smile. So what are you going to tell? What would you need to find out about this patient? I'm going to write down, if you're listing anything, if somebody can speak or you want to type it in and let me know. What will be the first question you want to find out from this guy?
Okay.
So let's name, I mean, we can name like 20 things, and please, Dr. Asawi, you're going to help me read it out, what they are. So this patient comes in for the first time into your clinic. This is the first time this patient is coming in. Obviously, you don't have much information from this photograph, but what would you be interested in finding out?
So Dr. Hassan Ahmed is saying, first question will be how you lost your teeth.
Okay. Yes, so how you lost your teeth, good. What else?
For me, doctor, for me, Azabullah, I would like to think or start thinking there's something systematic in this patient. So I will notice on this point, do you have any systematic disease or any chronic disease? I would like to ask him this one first, because I think this will be in this case.
I mean,
Dr. Muhammad.
Tamara, Dr. Tamara says medical history. You have to find, you know, first of all, you know, you need, I mean, I assume that any patient, so tell me, when a patient comes into your clinic, what do they do? What's the first thing they do? What's the first thing?
Sorry, Dr. Muhammad Barker is sending me, because he is now saying to the host, so you'll not be able to see the message. He was saying, do you have any medical problems? This will be his question.
Okay.
For the patient.
So I'm asking what to help us out here. When the patient comes into your clinic right now, okay, doctor, what do you require from them? What do you require from them when immediately they walk into your clinic?
I think sit in the chair. I'll ask them to sit in the chair for doing the diagnosis.
Okay, yes. What else?
I will ask our participants. Sorry, his chief, Dr. Hassan is saying chief complaint.
Okay, chief complaint, personal history. Yes. So I'm going through your scenario. I mean, it's quite simple. Do you give the patients any form to fill when they come into your clinic? Any patient?
Yes, Doctor. In Iraq, we have something standard in all the clinics. It's the medical or dental history form. It is in the clinics everywhere.
Do you have that form in front of you right now?
Actually, not yet.
Okay. So in that form, you need to know the name of the patient. You need to know their age. the form tells you whether they're married or not. The form tells you their medical history, stuff like that. So you listen to the patient, listen to him. Obviously, yes, you are going to listen to what is your chief complaint. What does the patient want? You are not assuming, doctors Al-Khaledi. Listen, you've got to listen. Obviously, you see the patient, you want to do his X-ray and all that, but first of all, you have to listen. You have to take history. You have to allow the person explain to you what they want. Obviously, they've already filled. So when your patient comes to your clinic, they fill a paper, right? Everybody does that. You fill. Some people don't do a detailed one. They just write, they rush through that. But I think you already have a system, a standard form that everybody fills. It gives them their age. So how old is this patient? So you're looking at him. If he's a young patient and his teeth is like this, then you're wondering, so the age gives you an indication of, something. Everybody does that. So looking at all that past dental history, past medical history. I don't know in Iraq if you guys do fee for service, or is there anything like health insurance?
No, doctor. Dental services is not included in the health insurance in Iraq.
Okay. That, because you want to, when you look at a patient like that, you want to find out whether they have insurance, or if they have, are they able to pay? Do they look, you got to size up when you see your patient. I think you need to size them up, because if obviously there's some things that require emergency, and there are so many treatment plans that you can offer. So what makes you, so you can offer A, B, C, D, and you kind of get a sense of whether they are able to pay. Sometimes why waste your time talking about some high things? Sometimes you might be mistaken. Somebody who you look like is not able to pay you something, will be surprised they have the money. So you need to figure out finances. You need to figure out whether these patients can afford what you're asking for, or they just want to, what do they want? If they want a good smile, can they afford it? So that will not determine what you need to do. Anyway, so this goes on and on. But as you look at your patient, I think, it's a good lesson for you to just come up with a scenario in terms of what you intend to find out about your patient. Doctor, there's a guy called Divan. He says that you should meet the minds of your patient before their mouth, because sometimes you want to just go straight into their mouth without meeting their mind. As a dentist, so that you don't treat a stranger, you need to meet their mind. So they're opening their mouth. Oh, open, let me see. There's a tendency for you to just jump in. Oh, let me see what the problem is. You don't even know the kind of patient. What kind of patient? What kind of mindset do they have? What is their, what is their mindset? Is this somebody that brought them there? Or is it the wife that said, hey, you go, husband, go and fix your teeth? Maybe the man doesn't want to come. So you need to kind of meet their mind, and it takes you a few minutes of just interacting with your patient to know the kind of patient. So you want to meet the minds of your patient before meeting their mouth. So that is essential that you do that. So in the minds of, there's a classification by house, a house classification of mental behavior of your patient, the mental attitude. This was a denture patient that Mr. Dr. House came up with a classification. So the minds. So what kind of minds do they have? So he gave us 4 categories of patients. One is the philosophical mind. Another one is the exacting mind. It's like an engineer. He wants to measure things. They want to know. It's very scientific in their approach, and they want to know everything. Exactly what you want to do. One is hysterical. Hysterical is like anxious. It's crying one minute, is laughing the other minute. It's just, some patients are like that. Some people, they keep talking and talking and talking. You don't even know where they are. So those patients are there. And one is indifferent. They don't care. They don't care about what you want to do. They don't care about, So these are 4 basic categories of patients. And everyone that comes into your practice, you should be able to, kind of, put them in a certain what you think, just from interacting with them, you should be able to know. So we're going to go into a little detail in terms of what to expect from these types of patients. So the indifferent patient, I had this patient, he has lost interest in social gatherings. They don't show any interest about their care. They don't care. They're just like, whatever you want to do. Well, I didn't want to come here anyway. So why, just whatever you want to do, I'll take it. So there are patients like that. They are indifferent. Let me go back. So I told you about the hysterical patient. The hysterical patient, they show a very, a lack of oral health, a lack of maintenance of their oral health. They are dentophobic. They don't like the dentist. They have a negative attitude. They are emotionally unstable, easily happy. The next thing they're crying. So there are patients like that. So they are hysterical. So at the end of the day, you class them in this whatever category, and you want to be able to get them to a place where they can cooperate with you to a certain extent. Because if your patients, if they cannot cooperate with you, you won't be able to achieve much with them. So this is an example of a patient. He showed up just like this, and the guy seems okay. It seems like, I was trying to suggest some stuff to him, and he felt like, well, he wasn't willing to accept what I had to say. He was very methodical, very precise. He was very strict, and he would make excessive demand. Oh, don't touch here. This is this. Do it this way. But you can see that they desperately need treatment. This patient made his own dentures. He made his own dentures. He said this was his own denture. He can eat with it. So I was wondering, why did you come here? I hope whatever you're going to make is going to be as good. I can eat with it. I'm like, I was even wondering, is this guy okay? But this was the way he presented, and he was very, very adamant about his condition. So have you had any experience of any of these 4 classes? Have you been able to say, can you look back and say, well, I think I have had patients who don't care. I have patients who are very exacting. They are too precise. Oh, no, dentist, you have to do it this way. Oh, my cusp is very, especially those who have some dental knowledge, the cusp is not doing very well. Help me out. Yeah. So any Dr. Asawi, is there any comments? What are the comments saying?
Yes, doctor, I'm checking now. I'm just writing down the question in the chat section. So I was just asking زملائنا الاعزاء، مريتوا بشي موقف، مريتوا بمريض مثلا شفتوه انه ما مهتم، مريتوا بمريض يخاف او بشي شيء من عنده تجربه بهذا الموضوع. So I think we have non-Arabic speakers, so I will ask the question again in English. So have you faced any kind of this situation, this categories of the patient characteristics, personality, something like that?
I mean, yes. Yes, go ahead.
Yeah, sorry. No, go on.
Okay, you are reading out the question, right?
Yes, I wrote down the question in the chat section, but I think not yet, because yes, we have a target of young dentists, fresh graduates.
Okay, so you let me know if there's if the comments are you want to talk about it. You can interrupt me anytime, but I'm just going to go on. Okay.
Okay.
So I'll go back. I'll just run through it again. So we have the indifferent patient. You have the hysterical patient. You have the exacting patient, and you also have the last one here, the philosophical patient. The philosophical patient is where you want to move all your patients to. You want them to be good. You want your patients to be rational. You want your patients to be sensible. You want your patient to be, obviously you cannot determine the mental status, but you hope that you can get patients that are well balanced and who have a confidence in your abilities. That is what we are all looking for. You need a patient who has confidence. Some patients, when they come in, they tell you, oh, my other dentist was very bad. Oh, they left their other dentist because they lost confidence. So how do you gain confidence? How do you, get your patients to cooperate with you? That is what I do on a daily basis. You kind of sense them out. Some of them, they complain to the administration. Some of them, so these things do happen on a daily basis where we get to experience different things from our patients. Anyway, I'll move on here. So there's another classification by GAMA, which is based on the level of the patient's engagement with the dentist and the treatment process. So if the patient is not engaged with what you're doing with you, then they tend to present in a certain way. And some of patients are not willing to submit. Are they willing? So it depends on the patient's willingness to submit to your recommendation. Some people just don't, some patients are like that. They are not willing to submit. Some patients are not willing to engage in the process. So you just come, okay. I mean, they are paying money for, I guess it's a little different if you're paying a lot of money for something, but that is what you will find in these classes of patients. So generally, based on the GAMA, I'm going to go back to the GAMA. Based on the GAMA classification on the patient's engagements and the patient's willingness to submit, you have this classification of patients. Some patients are ideal, so that's what you want. So they accept you as a professional. They're like, okay, yes, doctor, I accept you. You have gone to school. You know what you're doing. I'm going to accept what you have to say. Some other patients, they are submitters. So they say, you know what, dentist, you are the best. I like what you do, and I submit to whatever recommendation that you have. You also have patients who are reluctant based on this classification. I don't think they come in and say, like, I don't think you can help me. So you're wondering, why are you here? If you don't think I can help you, why did you come? Like the denture is here, is moving, this is the crown. They keep complaining about one thing. They are very reluctant to get anything done. And you also have the indifferent patient. They don't care. And they're like, you know what, dentist, do whatever you like. I will not even give you a second thought. They don't even give you a chance for you to even try. There are some that are totally resistant. Sometimes you begin to wonder, why would a resistant patient turn up in your clinic? But that is what it is. These patients do exist. Anyway, so I think the goal here is to be able to make your patients, whatever they turn up with, you want to be able to transform them by just interaction, by explaining the process, by going through, by even the help of your assistant, the office staff, or the way the place looks, to make them feel relaxed, to make them feel, cooperative with you. That is what you want. Are you going to be able to achieve that? So everybody walks in, you need a team effort to be able to make sure your patients, it's actually ideal. And some patients, they want to come back. They want to bring their family members when they come back. They want to have a pleasant experience with you, and it is key that we do that. Do we have anything in the chat section?
Sorry, yes, Dr. Hawra is speaking about your previous question about the personality of the patient. Yes, when I was studying in dentistry in Sudan, I saw many cases in the training clinic of the university in the same description. She's speaking about what you said.
Yes. Okay. All right. So I'm going to move on here. I have an example of a patient. So there's yet another classification. Obviously, we are all looking for the cooperative patient. Some patients could be either cooperative, is either they're cooperating with you, or they are apprehensive. It's like any small thing, they could be anxious, they could be frightened, or they are like, very obsessive. Oh, no, it's touching, the bite is not smooth, or they are complaining. There's nothing you do. Oh, the tooth you do is sensitive. The tooth you do, it has been feeling bad. I don't like the color. You have chronic complainers. And some of them are very self-conscious. Oh no, the teeth is shifted to the right, it's too forward. No, move it backwards. I want you to shave it down a little bit. The color here is not matching with my gums. Some people are very self-conscious. I think the tooth is too forward. You need to take it backward. Those patients are there, and you've got to be able to manage them, from being apprehensive and uncooperative to a place where you can. Sometimes you don't have to do major stuff, very late in the evening. You want to start in the morning when they are less stressful. You want to do the hygiene first. Just kind of build them, give them a way to get into your practice in an easy way, okay? I'm going to move on here. So this is an example of a patient whom I saw. Initially, when this patient came in, I wanted to find out about Miss T. I'm like, okay, what's her chief complaint? What is her dental expectation? What does she expect from us? What is she expecting from the visit? What is her lifestyle? What does her lifestyle say about, how does that affect the way I'm going to treat her? So the lifestyle is crucial. Some people are chronic drinkers of soda or soft drinks, so that lifestyle, it's going to affect what you do. So, find out about their lifestyle. So a patient comes in and it's like, you have to know a lot about them, especially if you are doing a lot of work that will require them to come in all the time. In terms of, are they able, where do they live? Where does your patient live? I have patients who live 4 hours away, 3 hours away. So you need to know, so when you're planning to treat them, you need to bring them in on time, and you got to, and be mindful of their time, that you're not going to be wasting their time, especially if they drove 4 hours, 5 hours to your clinic. You want to put them on the schedule on time. You want to make sure that you are mindful. Are they getting enough sleep? Did they rest well? Did they drive? Are they going to be cranky? Stuff like that. What are their constraints? Some people, do they have transportation? Do they have the money? Do they have people to come with them to clinic? Do they have family members who are supportive of their treatment? Do they have help? You need to find out what their constraints are so you can plan your treatment, in accordance with what they present. So this is a patient. She came in and she said she wants to restore her self-esteem and her confidence. So this is the patient. She smiles. I'm surprised. So there's so many things going through my mind. What would be going through your mind? You can type it in the chat. What would you like to find out? The patient presents, you look at the mouth, you're like, wow, what is going on here? Are you on? I'm wondering. I went back to the medical history for this patient. I'm like, is this patient on drugs? Is this methamphetamine? Is this neglect? Is this patient okay mentally? Is this patient all right? Is it, what is going on in their life? Is she going through depression? Is she going through what? So I open the patient's mouth. After looking at the medical history, I read through the history. Nothing jumps at me when I look at the history, but I look at the patient's mouth and so many questions are coming to me. I'm like, what exactly is going, how did this happen? Does she drink, does she eat fruits? Is she a smoker? Is she take, chronic alcoholic? Is she into, cocaine or methamphetamine or heroin or kind of something? What are the questions that will come to you when you look at your patient like this? Go ahead.
Doctor, there was answers in the chat section. First one was from Dr. Duha. She just directly answered drugs or myth mouth. Also, there's Dr. Tamara. She's saying, why her teeth like that, as you said, lifestyle of the patient. Dr. Nebe is saying, bad habits. Dr. Milad,
okay.
Dr. Milad,
so
lifestyle.
Yeah.
Yes, Dr. Milad is saying lifestyle and habits.
Okay. So when you have all the, so you have this sort of, there's definitely something this patient is into that needs to change. If not, any treatment plan you present is going to go back into the drain. So how do you modify the behavior of this patient? So you need a lot of counseling. You need so you need to, so many things. And we'll go on. You see. So is there any more comments in there?
تعليقات إضافية عندكم على هذا السؤال أو هذا الموضوع? Any other comments? You can write it down in the chat section.
So you look at it, you are looking at, I'm thinking of erosion, I'm thinking of attrition, I'm thinking of bruxism, for a mouth. I'm thinking of vertical dimension of occlusion. Has she lost some vertical dimension of occlusion? She has, this is a severe wear case. And, so I'm beginning to think. So as I see the patient, I'm thinking of treatment plans. I'm thinking of constraints. What are the things that could be a problem? I don't want to treat a stranger. Okay, I want to know who this patient, can this person come for appointments? When I make appointment for this patient, is there any constraints in their life that make it difficult for them to show up very frequently for us to give them the best that we can offer? So many things, questions are coming to my mind. I look at this medical history, smoking, liquor, so you need to take all that and read it all over again and be able to come up with a treatment plan based on their history. And you got to be able to marry everything together to be able to come up with something. So when I look at them, I say there's some tooth wear. So I look at the islands, the amalgam islands, and I can tell, I can almost say that she's, there must be some erosion and that is coming, and it's mostly on the lingual. So you look at the pictures, everything tells you something. So the X-ray, the photographs. So you try not to have a stranger. You need to take your diagnostic records. You need to take diagnostic records so that you'll be aware of the patient. You need to mount the cast. You need to find out if there are any TMJ issues. You need to find out about why the wear, why this kind of wear, what is the pattern of wear, what is causing it? Does she have bulimia? Does she have GERD? Does she have any acid reflux? There's got to be something, because it's not just bruxism. There's something, and it's all mostly on the if you look at the bottom, most of the bottom teeth are not they're not involved in the wear. And you look at the top. This is the top. The top has wear. The bottom does not have wear. The bottom does not have wear because obviously whatever is eroding the tooth is being protected by the tongue. So I'm thinking there's something coming from the inside that is causing all this wear. The wear is happening on the lingual cusp of the top, and is not happening on the lower teeth. So I'm beginning to think, so it makes you think. These photographs help. I don't know if you do it on a standard and on a regular basis, but here, I've come to learn. So when my patient is not there, I can take a look at this patient and begin to see. And the more you look and the more you read, you can find out a lot of things. The patient didn't agree. Is the patient, is she swooshing alcohol? Is she swooshing alcohol? Is she drinking alcohol and keeping it in the mouth and just swooshing it back and forth? So it's that way. If you don't correct all those things, then whatever you do. And I'm looking at the mouth, and almost every tooth has wear. And so I'm beginning to think materials. I'm beginning to think a night guard. So this person is a bruxer. She's a bruxer. In addition to all the erosion going on, she takes a lot of soda, from what I can see, and she takes a lot. She takes a lot of alcohol as well, and she obviously has some acid in her mouth. So looking at the patient as such, I'm beginning to formulate. I'm beginning to think. As I think of the treatment plan, I'm going back to the patient's lifestyle. I'm going back to the issues about constraints. Does the patient have the money? So when I think about this patient, this is like a full mouth rehabilitation. So when I'm thinking of my full mouth rehabilitation treatment, I'm beginning to go back to the patient's lifestyle and learn about the patient to see whether the patient has enough. Does the patient have money to manage? Because this case, for a full mouth case like this case is going to cost $30,000. That sounds crazy, right?
Yes, totally crazy, especially for the Iraqi market. I
Yes.
don't believe any patient in Iraq would pay for that.
So you are thinking, what are you going to use composite? If you use composite, obviously it's a lot cheaper. Composites obviously is going to wear again. Is going to go back into another wear, and maybe the patient. So you can actually go. So I'm going to talk to our environment where we live. So I offer these patients a treatment plan of $30,000. And I'm looking at the patient. Can this patient afford it? I'm going back to our lifestyle. Is the money going to be a constraint as we take care of this patient? Can she afford it? Before I go ahead, I need to see the money. I'm not going to go ahead and prep any tooth if I don't see at least 50% of that in the account. And the patient paid. I was surprised. I was extremely, so sometimes you look at patients and you kind of look at them and say, are you sure this person can pay? And she paid the money and we got started. Yeah, obviously you're thinking of different treatment plans. So you can go back and do the fillings all over again and use an occlusal guard, a night guard to prevent and to find out about the sugar intake and to control all that. There's some behavioral things that you need to take care of. But my treatment plan goes back to, is the patient a stranger? If I was treating a stranger, if I didn't know whether a person could afford it or not, then I would have wasted my time offering something without knowing whether the patient can pay. So I'm gauging the patient. I'm asking, and here we are. So I look at the X-rays again. Say, do this patient needs endo treatment? Does she need anything? Is there going to be, So you don't want a stranger by making sure that you have the information. All the X-rays must be complete. Don't just take only one PA and walk away. You need a full mouth series for most cases. So you look at everything in detail. You don't get surprised by, is there going to be recurrent caries? Is there any periapical radiolucency? Does any teeth need to be removed? Stuff like that. You want to be sure, look at it critically, stop and look and check and be sure that you have everything together.
So sorry, doctor, I'm sorry for interrupting. You have few questions for this case. Do you want to answer it now or later on?
Go ahead. Let's answer it because we're getting out of, yeah.
Oh, okay. First one is from Dr. Milad. Why not muscle deprogrammation?
Yes. For the attrition and all that. So the patient has so you either use that a night guard or you use the Temps. So we're increasing the vertical dimension of occlusion for this patient. And one of the ways to find out whether she'll be able to tolerate it is to make a night guard at the new vertical dimension of occlusion, and she wears it for like 6 weeks as a form of deprogramming, or to see whether she's able to adapt. More of an adaptation, because it's not just deprogramming. You are going to change the dimension of occlusion, and you want to be sure whether the patient can adapt to that. So the patient has. So we did make one in-house but for this case, I'm using the Temps as the deprogramming device. So the temporary is acting. So the temporaries so we did a wax up of this case, a full mouth wax up, and after the wax up, we made temporaries based on the new vertical dimension of occlusion, and we prepped the teeth and we gave Temps, and over the Temps we placed a bite splint, because at the end of the day you don't want her to grind off all your Temps. So that bite splint she's using as a sort of deprogrammer or an adaptation device. Okay, so we did start by, so in treating this patient, I wasn't sure whether the patient could afford it. The patient said yes, but she didn't put the money down. So I just told myself, you know what, I'm just going to treat the patient in phases, because the full amount of 28 30 crowns. 30 crowns. And so we did start by prepping the anterior 6, and we went, anterior 12 teeth were prepped, and we put Temps. And from there, case went on, took an impression of that, made a lab. So I made Temps in-house and also made a lab fabricated temporary. So we did prep the anterior 6, both top and bottom. So I kind of did some core. So I went in there, cleaned out all the decay, softened dentin, did some core build up on all the teeth that we were working on, and moved on from there to put the Temps and to make sure. So we fabricate these Temps. So I put up that impression and made Temps out of the impression, such that because you want the gingiva to be healthy, because if you want everything to be healthy, no bleeding, no because you're trying to prevent decay, because this is a recipe for disaster if the patient has recurrent decay. You have prepped all the teeth and things are going to be, it gets really worse very quickly. So you want to make sure that your temporary restoration is right at the margin. It takes a lot of effort and detail to make sure this happens. And so this is where we are. And this is our patient currently. And she's in Temps, and she's been able to pay. I mean, I was surprised. I was surprised that she was able to put up with the money, but this is where we are. And I think we did fair good by just the fact that things were not taken. The patient no longer became a stranger. I got to know about her family. I got to know about her children, her struggles, and this and that. So that kind of helps build the bond and build confidence in what we were able to do for her. I'm going to move on quickly here. So this other patient, exacting patient, very difficult case, because he needed a lot of alveoloplasty. He needed to reduce all this bone, and alveoloplasty really hurts. It really hurts, and being an exacting patient, it was no mean feat. I had to get the oral surgeons involved, because he was like a 78-year-old patient and needed oral, he needed sedation, he needed to be put, he just didn't want, the guy was really complaining about every step. So I had to get another team involved with me to do it. So we did go in there, and all that bone, all this bone, shave it out. It took some time, shave it out, and with the help of the other team, so you have other people, other specialties, I made the surgical stent to tell them how much. I was there for the surgery to determine how much they needed to reduce, and that is it.
Okay, doctor, we have two questions for the last case, for the female case. Okay, from Dr. Mahmoud. Dr. Mahmoud is asking, how would you determine centric occlusion, MIC?
Yeah, so the patient has, she has wear. So you kind of determine how much wear, how much has the patient lost. You can tell from the wear how much of the central incisor has been ground down. You can and we made it. So we did a wax up. So based on, so it was more of a trial thing where we waxed up the anterior teeth and on the lingual and raised it up by, because most patients can accommodate 2 to 3 millimeters. So I increase put some wax on the lingual of the central incisors to 3 millimeters. So we increase it by 3. There is a paper by Turner who says that sometimes it's not every case that has a collapsed bite that you need to reinstate, because there could have been physiological adaptation. But in this case, I believe that there was no adaptation. A bite was collapsed. You can see it from when she closes her mouth. You can see from the tension in her cheeks. So we did open it, and so we used so based on the articulator. So we did everything in the articulator, increased it some, and we felt it was just okay. So we prepped the anterior teeth, the first 6 on the front from canine to canine, and made the temps to the increase that we had done on the casts. So 3 millimeters in the front, and we put that, we installed those temporaries, and she's had them for a while, just to be able to see whether she was going to be able to cope with them, and she didn't have any problems. So between 2 to 3 millimeters, I think you can increase anybody's bite without any problems.
Okay, doctor, another question from doctor. He's asking, do you use golden proportions?
Yes. It depends on the case. But for this case, what I did here was, by the time I put it on the cast, I just increased it by 3 millimeters. And obviously, you increase you got to be able to have some posterior support. So once we increased it by 3 millimeters, and we put the temps, so we had to build up the posterior teeth with composites to make sure that she had posterior support with the new bite. Because without that, that's a problem right there.
Okay, doctor, another question from Dr. Abdurrahman. He's asking, do we must use bridge or crowns on both arch? Because using of a bridge on one arch will increase attrition.
So these are individual crowns. She's not missing any tooth. She's not missing anything. So these are, we're planning individual crowns. Individual zirconia crowns was what we planned and we're executing for the patient.
Last question from Dr. Naba. She's asking, do we should do the separated crowns because of the periodontal hair?
Yeah. We're not joining. We're not splinting anything here. There's no indication to splint. She doesn't have any perio issues with any of the teeth. None of them is mobile. From the periodontal chart, no indication to do any splinting in this case.
Okay, doctor, I think now we are done with the questions, so everything is fine. At the end, we'd like to thank you so much in the name of the Iraqi Dental Association for your lecture today, and we'd like to thank our participant today. Thank you so much, and we will meet you again in another lectures from the Iraqi Dental Association Continuing Education Online program. Thank you so much, doctor, and thanks for our participants. Have a nice day, all.
All right, you guys take care.
Thank you. Bye-bye.